Hey guys, it's me, Dr. Ree. In this video, we're going to be talking about the lumbar plexus and the sacral plexus, also together called the lumbosacral plexus. So starting with the lumbar plexus, there are a few nerves that we will be identifying here. The main thing with this is, and you'll see in the lab that I write out a bunch about what the nerves do when it comes to this, just because there's so many nerves here, but kind of knowing where they are in the order, or just knowing a mnemonic that helps you remember what letters are involved is going to be helpful when you have a question that says, which of the following nerves is part of the lumbar plexus, right? So we're kind of grouping things in our brain. So for the lumbar plexus, one of the ways to remember it is I get lucky on Fridays. It's lucky, right? Because it's the weekend. So anyway, that stands for, the first I stands for what we see up here in the top, which is my ilio-hypogastric. That's going to go to my hypogastric region, right? That's where the name, ilium. Underneath that is my ilioinguinal. Ilioinguinal is going to supply the inguinal region. Underneath that, for I get with the G, is my genitofemoral. Genitofemoral is going to supply the genital region. Then we go underneath that for my L. That stands for my LCF, which is my lateral femoral cutaneous. I misspelled cutaneous. Cutaneous nerve. Also abbreviated LCF. LCF, the lateral femoral cutaneous nerve, supplies the lateral aspect, the sensation of the lateral side of your leg. This is a common nerve that for carpenters or for women who are pregnant, if they have compression of this nerve, it can actually cause numbness on the side. So they'll think it's like IT band or something like that. And in reality, it's actually way up in our lumbar region, and it can be treated by relaxing that region and opening up that area. So that's the LCF. And then the O stands for obturator. Now, in this image, the obturator nerve is way over here. See how it kind of whoop, it got over here. That's because, but it is in our kind of saying before the F, which is femoral, and that is because if we look here, this one is starting a little higher up than we have our femoral. So this one way over here is obturator. And this one right here is my femoral. Whoops, my pen freaked out a little bit. Femoral nerve. So those are the nerves. Now this arrow right here, this is pointing to that we're going to start from L4 on down is going to be where we see our lumbosacral trunk. The lumbosacral trunk is what's kind of the connection between the lumbar plexus and the sacral plexus. So that is our first plexus. Our next one we're going to look at is the lumbosacral plexus. So this is that combination of where they kind of come together, and this bottom part is going to, the bottom part is going to be my sacral plexus. Up here was my lumbar plexus. This is kind of where they come together, meet in the middle. Okay, so again, starting up here as we come through, so you see right here, that is my lumbosacral trunk again. So you can kind of just see that. It's going to be the same thing from here. So I'm just showing you that this is kind of an extension of the image we saw up there. So let me label that. Lumbosacral trunk. And from there, now we get to our nerves. So the lumbosacral trunk is not one of the nerves that we're talking about when we're talking about the sacral plexus. It's just kind of a region. But what we see right here, the very top one, so my little way of remembering it is we have sips. Right? I get lucky on I get lucky on Fridays, and I sips a nice cup of tea. Or if you're over 21, maybe it's a beer, just like when we talked about brachial plexus, we said, remember to drink cold beer. Okay, so SIPS, the S stands for superior gluteal nerve. Now, Here's my hint, and I'm going to talk about this in lab. Superior gluteal nerve is going to supply a gluteal muscle, but the gluteal muscles that it supplies is not glute max. It is going to supply gluteus medius and gluteus minimus. It's going to be the opposite of what you think, because you see superior, you're automatically going to think the most superior muscle of the butt. No, not right. Because underneath it, for the eye, is my inferior gluteal, and my inferior gluteal nerve is going to supply glute max. It's a common thing people get confused with. So this is going to do glute med and glute min, and this is going to have glute max. So don't get confused. It will be a question because it's so commonly confused. Specifically, it could be a question that could be on your lecture exam, so definitely in lab, I'm going to reiterate it. Then we come down here, and we have our first P. Well, we have a few different P's going on, but one of the P's that we're going to be looking at right here, we have our pudendal nerve. And then next to that right here, we have our posterior cutaneous nerve. So that's going to be our posterior femoral cutaneous nerve. That's going to do the back of the leg or the back of the thigh cutaneous sensation. And then we have our S, and our S is this nerve right here that you kind of see with this big arrow right there. This big thing right there. This is my sciatic nerve. Now you can see this sciatic nerve has two parts to it. Now these two parts are part of the sciatic nerve, and we have our peroneal or our fibular nerve and our tibial nerve. So tibial nerve and our common peroneal nerve. Peroneal also could be called fibular nerve. These are not part, these are not part of my sacral plexus. They are two parts of the sciatic nerve. The sciatic nerve is the part that's part of it. So let me highlight the ones that are actually part of my SIPs: superior gluteal, inferior gluteal, pudendal, posterior cutaneous, and my sciatic nerve. And then if we look here at our lumbar plexus, iliohypogastric, ilioinguinal, genitofemoral, LFC, femoral nerve, and obturator nerve. And that is the lumbar plexus and lumbosacral plexus. And we'll talk more about the muscles that they innervate in lab.